My name's Dr. Helen Care, and I'm a clinical psychologist, and I work for A Confident Start, which is a clinical psychology practice that works mainly with children, young people and their families. I work across the lifespan for children and young people, and the main areas of difficulty tend to vary a little bit with age. So generally speaking, when you're talking about sort of younger, sort of infant school age, key stage 1 type early years, then you're tending to talk about sort of parenting, family interaction, attachment, how people are getting on with the relationships at home, and some of the sort of behavioural aspects of that. And that might be managing sort of temper outbursts or managing sort of communicating about emotions at home. As children get older, it tends to get slightly more focused on them managing their own emotions themselves. And so at sort of top primary end, I would do quite a lot of work around, particularly around sort of anger and anxiety and how those are expressed and how they can often interact. So primary, what we tend to see is issues around kind of anxiety around social interaction and friendships, and general anxiety in terms of sort of how do I keep myself safe and well, and is washing my hands enough, and worrying about germs. And also quite often what happens, and this would be consistent with what we'd see previously, is that particularly in the sort of middle to late sort of primary age is a lot of anger coming out, and quite often actually it looks like anger, but really it's worry. It's feeling anxious and that anxiety bubbling over and spilling out as tantrums or shouting, or just not being able to contain how anxiety provoking the situation feels. It's particularly around the kind of focusing on other people, socializing, sharing, recognizing that you have things to give in relationships to other people, but also that other people have things to give to you. Certainly something I've noticed in my children is that the capacity for sort of listening to other people, sharing ideas, has definitely dropped off a bit. And whilst they're excited about socializing, the actual skill of taking it in turns, of listening and waiting and seeing, does someone else have a good idea that you might want to join in with, that's been more challenging, and they are going to need time to rebuild those skills. Secondary school tends to be slightly more focused on the kind of mid to longer term, what's the implications of this? How do I fit in with other people? What are other people's judgments of me? What's the implication going to be for the rest of my life? How is this affecting the rest of my family? And we know that, adolescence, the whole task of adolescence is to move from very focused on yourself within the family to focused on moving away from that, to taking on independence, to working out your place in the world. And so the anxieties and the mental health issues that go along with that are similarly focused. They are, who am I? How do I fit in? Where do I want to be? What kind of person do I want to be? And how does my mood fit with that? Do I have the motivation and energy to be the person I want to be? Are there things standing in my way? I think the biggest thing has been the social interaction, but I really do think that particularly for young people, and I think for young people at different ages, it's really had an impact in different ways. So when you think about some of the teenagers that I work with, actually being on screen and socializing with their friends on social media felt relatively normal already. And so for some of those, particularly some of the older teens who were already communicating like that, that didn't feel like such a shift. Although I think that the sole reliance on that has really had an impact on people's sense of, what matters about them, and I think hugely on mood, because what seems to have been true for most people is that it was a bit like we took a lot of the colour out of life. That although things ticked along and there were, we carried on a bit with schoolwork and we had some things to do and we were allowed to go out for walks, what was missing was all the real brightness, the moments of joy that were harder to find, and the interactions with friends that felt more connected and meaningful. They were much trickier to get hold of. So I guess the biggest learning points for me have been about just how resilient and creative we can be, really. That, it was absolutely necessity that forced me to work out how to work digitally and how to see people online and how to do sessions without being able to physically be in a room with someone. And we rose to the challenge, and most people did, and we found ways to do it. And that's something that I would want to keep going with, actually. That's something that I wouldn't want to lose completely, even when we go back to being able to do face-to-face and more, quotes, normal therapy. I would want to be able to keep that option open. And I guess that creativity and resilience generally, I think I've seen that in society, and I've seen that in the young people that I'm working with, that we've come up with solutions, we've come up with ways around things. And although it has been hard, there definitely, there've been some lovely moments in there. And almost everybody I speak to can name some little story, can tell you some story of something that was lovely, or some moment or some experience that they maybe feel like they would have missed out on had they not had this last year. Some connection with the natural world, some connection within the family, some closeness of a relationship, some recognition of actually which friendships really mattered, which relationships within a community were so important. And I think that sense of kind of connection has been really, really important, and important not to lose. I'm all about telling stories, and I think there's a massive power in the stories that we tell about young people. And if we tell them that, it's doom and gloom and that they've lost all this time and it's all awful, then that is the narrative that is going to become dominant. And I think it's so important that we shift that, and that we start looking at the narrative that says, well, how well have they handled this? This came out of nowhere. No one prepared them for it. No one expected this. They are the first generation who have ever had to do this, like, in this situation, and look how well they've handled it. They have worked out how to tolerate being taught in a way that nobody else has been taught before. They've worked out how to do that. They have coped with exams being taken away from them and then reinstated, and then taken away and then reinstated. And they've managed such a lot of insecurity and uncertainty, and they still find joy and excitement. And the young people I work with are just so inspiring, because every single one of them, even the ones that have really struggled, can tell me something, can tell me some moment that has been important to them, or where they've found some way of picking up or bringing joy to themselves or to someone else. And if we don't tell that story, we do them a massive disservice.